And he's going to do our invocation for us.
If you would join me in prayer. Dear Father, thank you this morning for the opportunity to join together. Lord, thank you for our Constitution and Bill of Rights that guarantees us freedom of assembly, freedom of speech and of the press, freedom of religion. Lord, we thank you for the privilege of worshiping you. Lord, we know that you're the only one that can solve the problems that our country faces today. We know you're the one that can heal all the diseases. So, Lord, we commit all of this to you first and foremost. We ask that you would give us wisdom. Lord, we know so many people are making tough decisions right now, and Lord, we ask that we would have respect for all those that are in authority. We ask that you would help us to understand how each one of us can play a role in helping our country to come out of this COVID-19 crisis with strength. But Lord, help us to protect our liberties and help us to protect those who are trying to provide for their families. Father, I pray you give wisdom to each one that speaks today. May all things be done for your honor and glory in Jesus' name. Amen.
Amen.
And I'm going to introduce my colleague Stuart Jones, and he's one of the ones that helped organize the rally. So, Stuart, take it away.
Thank you very much, Josiah. First and foremost, I want to tell everybody, so this has been just unprecedented. Has been used, that word's been used over and over and over again throughout this whole event. And I understand that. As legislators, one of our guiding doctrines, and I know this group up here, myself, Jonathan Hill, and Josiah Magnuson, one of our guiding doctrines are what the founders taught us about never trading our freedoms for security. And it may be difficult to understand that sometimes. When this COVID-19 crisis first happened, and we started seeing this pandemic, the data, we didn't have good data. There was a lot of assumptions going on. And policymakers have made a lot of decisions that affect the people behind me today. We've got cosmetologists, hairdressers, small business owners from around this state whose financial life and lives, their livelihood has been completely devastated from the events, from the actions that government has taken. So while the virus is real, I want to say that the data that we've got now and what we are seeing around the country, there are tests going on where we're seeing more and more people have actually been exposed to the virus. There's more people have more antibodies to the virus. And so what I'm getting around here too is that fatality rate that we are seeing, which has been calculated off of the actual people that have been tested as infected, is a very misconstrued number when you look at the vast scheme of the population. So what I'm getting at here is a couple of these business owners, they took it upon themselves and started some petitions online. One of those petitions, Amy Howie, started a petition that actually has over 500,000 signatures and counting currently, just incredible, and that's nationwide. Out of that, it's got over 50,000 South Carolinians have signed that. That's barbershops, that's salons, that's cosmetologists, that's everybody who has been affected by their business being shut down. I can say as a representative too, the calls I have gotten over the past couple weeks, I've been in tears over these calls, folks. I mean, you get calls from people who have never asked the government for any assistance in their entire life. They don't want to ask the government for any assistance. They want their freedom. They want to be able to run their business and run their lives. That's what makes us unique, I thought. So, but they can't get help. They can't get unemployment. I have tried to help them file for unemployment, some of them 3 and 4 times. The SBA loan has been a disaster. Meanwhile, the federal government is going completely bankrupt. There's now talk about once we run out of money, once the trust fund is broke in South Carolina, that guess what? We're going to get a loan from the federal government. And this is all avoidable. This is ridiculous that we are in this situation right now. I have called on Governor Henry McMaster. I've called on our leadership in the General Assembly to intervene, to think through this thing, and to put forth some precautions, some guidelines, some solutions, that people can go back to work on. Not say that we're going to sit and wait on this or let a planning committee, who knows how long it's going to take. So, and I want to say this too, a lot of these business owners standing behind me today are some of the most regulated people in this state. South Carolina has over 70,000 regulations. And a lot of that is on the people in cosmetology. It's the people behind me. It's also restaurant owners. those people deal with this every day. They're some of the cleanest places in this state. And so to tell them that, we're going to leave the big box chain stores wide open and that, you can stand in a line with 20, 30 people in one of those places, but you can't go get your hair done one-on-one or your nails, is completely, it makes no sense. So we want some common sense approaches to what's going on here, and that's what we're asking the governor for. We are asking the governor today, when he renews his executive orders and his statement of his emergency orders, we are asking that he give these businesses some freedom. These are the people we represent in this state. These are the people we work for. Government has no place intervening in their lives and telling them they can't open up their shop and feed their families, and that's what's going on. So it's time to stop this mess of thinking that government can make decisions for these people. Really what it comes down to for me is having confidence in people. I have faith in God and I have confidence in people. I have the confidence that people have the God-given ability and the minds to make better decisions than a committee of government planners, than anybody in government, than us three up here. We're listening to the people. And that's what we are asking that the governor do and the General Assembly do. Now, if the governor doesn't do that today, if he doesn't make some kind of effort to give them something, then I am asking that the General Assembly call session. I'm asking for Speaker Lucas and President Peeler to call session, get our representatives in session, and come up with a plan here. This is ridiculous that these people have had their hands tied the way they have, and I'm not going to stand by and watch it. And when you get so many calls, like I do, from people that are struggling, asking for the assistance, not getting it, that's why I'm furious today. That's why I'm upset, and that's why something's got to be done. So next, I'm going to introduce Amy Howie, who started the petition, which has gained over 500,000 signatures, and it's still going, you guys. We're gaining more signatures. Everybody is getting more signatures by the day. We've got to open South Carolina back up, and that's what we're asking. So here's Amy Howie. Please give her a warm welcome.
Thank you, Stuart. Yes, I started the petition April the 15th in hopes of getting 1,000 to 1,500 signatures. I never expected that it would go viral and gain as many signatures that it did. And I'm just so thankful of the outpour of the support that we have gotten for hairstylists and barbers in our industry. Numbers speak that is what is important to our community, that they want us to be able to work. They want us to be an essential business. And as a licensed cosmetologist, I'm licensed in North and South Carolina. I own Papillon Salon in North Myrtle Beach. I also have a hair loss specialty center, and those clients, they have to come to me at least every 3 to 5 weeks to get their hair serviced. They have medical grade bond on their scalp. They cannot go week after week without having their hair serviced. They risk the chance of having an infection, inflammation, a fungus, any of those things. I actually had a lady call me this morning at 6 a.m. from Columbia. She said that her hairstylist cannot do her hair because legally we would lose our license, and she wears a hair unit. And those are the people that really made me move to do the petition, because we have our hands tied. When we cannot work, we don't have a paying client sitting in our chair, we make no money. And I'm not asking for a government handout by no means. I expect to be able to go into my work and make an honest living. I think that's what we all speak for. I have 4 stylists, and same thing, a lot of us, we don't qualify for the small business loan or the unemployment or the PPP loan. So we just, if we're not having paying clients, we make no money.
Thank you,
Thank
Amy,
you.
very much.
Thank you.
Would you like to introduce Sari?
Sarah?
Yeah.
I opened my salon on March 1st, and we closed on March 19th. That wasn't even 2 weeks that we were open, and I poured my life savings into this whole entire business that I could potentially lose. Our regulations by the LLR, we are so regulated. I went through hell to even get a business license, and in doing that, we have so much sanitation, disinfectant. We study microbiology. Most people don't know that. I've done hair for 15 years, and I've never had lost this much income. And it's not fair, and I feel that there should be a choice that if a stylist can return to work, they can make that decision, and it can be a decision for whatever anybody wants to make. I just feel that we should have a choice, and we need to reopen, and we need to do it now. Thank you.
Well, thank you, Stuart, for helping put this together. Representative Jonathan Hill, I represent the western side of Anderson County, and arrived here today and came into my office and found 3 pieces of mail in my mailbox from within the last several weeks from constituents, business owners just in my district alone, asking for the ability to reopen. I would call on the governor today that as the most recent state of emergency is set to expire today, that he not only cite the constitutional basis for the actions that he is taking or intends to take, and in addition to that, that he, for the first time, have DHEC cite the actual evidence for which we're continuing the shutdown. Is the shutdown reducing the caseload? Is the shutdown reducing the number of deaths? I haven't heard DHEC come out with the first shred of evidence to that effect. And in the implementation of this shutdown, it's been full of inconsistencies, full of bizarre orders like you can't go out on the lake and fish. I represent an area surrounding a big part of the shoreline of Lake Hartwell, and for a period of time, my constituents were not legally able to go out by themselves solo on their bass boats and fish. How does that help? Newsflash, it doesn't. I'm calling on the governor to actually take evidence-based actions. Where does the evidence lead us right now? You know, I understand, I and my colleagues, we were willing to give the governor the benefit of the doubt 5 weeks ago. When this was all starting, when we didn't know how bad this was going to get, when cases were just first starting to appear in South Carolina. Today, we know a little more about this than when we started. And what we know is that the predictions haven't come true. I'm glad they haven't come true. But you know what? There's a lot of reasons for that, why that could be. And I believe it's the height of hubris and narcissism on the behalf of our state leaders if we assume that it's our actions politically that save lives and keep people from getting sick. Governor, it's time to establish that fact with evidence. And if you can't do that, it's time to end the shutdown. It's time to let these orders expire altogether. It's time to let South Carolina get back to work. Thank you.
Thank you, Stuart. Representative Josiah Magnuson from District 38, Northern Spartanburg County. There's so much to say here, of course, it's hard to know where to begin, but I think the appropriate place to begin is with my constituents, the people that I actually represent. Representative Jones mentioned that, you know, he has gotten so many people crying out for help, and I, of course, am the same way. I think Representative Hill, Representative Long would say the same thing, that we've got so many people in our districts that just don't know what to do. I can count on probably one hand the amount of people that have been asking me to make sure that the shutdown continues. On the other hand, I get calls every single day, emails every single day saying, hey, when can we get back to work? When can we provide for our families? We're seeing suicides. We're seeing domestic violence. We're seeing patients that can't receive care because the hospitals are furloughing workers, and in some cases across the country they're shutting down. We're seeing potentially food shortages. Former South Carolina Governor David Beasley, that's now at the United Nations, has stated that around the world we're going to see potentially famines. And if you think that that's only going to be third world countries, I think you're mistaken. I think it's going to be a bigger impact than what anybody imagined. And so we got to be very careful. These are very real situations that we can't just shrug off. We got to realize that government action sometimes has long-term consequences. Now, So we need to really take this seriously. We need to end the shutdown. I think my colleagues support opening up all businesses right now. I mean, we can still take the social distancing measures, the safety measures, and we should do that. But there's no reason why, if an essential business is operating with safety measures, that a non-essential business can't operate with the same safety measures. So everybody should be allowed to go back to work, and so that's where we stand today. We are calling on the Speaker of the House, Jay Lucas, and on the President of the Senate, Harvey Peeler, to call the General Assembly back into session. The need right now that we have is the governor, of course, has continued to extend the state of emergency beyond the legally required 15-day limit. So this, if he extends it again, it would be the fourth state of emergency that he's declared. The Attorney General issued an opinion in response to my request a couple weeks ago, and said basically that what the governor is doing is legal, but that the General Assembly is providing consent to the governor's actions by way of silence. And so really the burden is clearly on the General Assembly now to act. And so what we're doing is we're calling on Speaker Lucas and President Peeler to act. We need to get our state back up and running again. That doesn't mean we go back to the way things were before. What it means is that we put in place effective guidelines, safety measures, so that people can work, but then also we look at when do we end the state of emergency. We look at when does this come to a close, by what guidelines will this come to a close, use some common sense, and as Representative Hill mentioned, some evidence-based actions rather than just continuing to go off of fear. So that's what we're calling for today, and I guess we'll be happy to take any questions.
And we'll have
And Representative Long will speak as well. Okay, great deal.
Good morning. I'm Stephen Long. I represent District 37 in Spartanburg County. I'm delighted to be here today. Stuart, thank you for putting together this event for us this morning. I'm appreciative of the efforts to protect South Carolinians and to make sure that people are safe. And I think that all of us here are sensitive to the concerns about what the health concerns are related to COVID-19. But I think a lot of us here also recognize that the economic impact is tremendous. And every day that this shutdown or this lockdown goes on is going to be worse and worse for the people across South Carolina. And every day that this goes on, that's more business owners that are not going to be able to open their doors when things do open up because they've already experienced economic devastation. And so I think what we're calling here for today is a safe and a sensible reopening of businesses across the state of South Carolina. Look, business owners that I've spoken with are willing to voluntarily take those safety measures. They're willing to take clients by appointment only. They're willing to make sure that they don't have a waiting room that's filled up. They're willing to have the lines that are spread out so that people have that distance. They're willing to make sure that they're washing their hands more, that they're using hand sanitizer, wearing masks as appropriate, and things like that. People are willing to take measures needed to stop the spread and to protect the health of the people and the public. But what we can't do is shut down businesses continued. And we can't afford to have all these businesses go under strictly because we're trying to extend this lockdown when the data doesn't support it. It's like Representative Hill said. Weeks ago, we didn't exactly know what we were dealing with. We didn't know how bad it was going to be in South Carolina. But based on the data that I get every day from DHEC, the curve is flat. We are not having a spike in cases. We're not having this massive overload of our healthcare systems. Our hospitals are a little above 50% capacity. Hospitals are laying off employees because there's nobody there that need help. So we're not seeing, when the lockdown was started, 4 or 5 weeks ago, it was because we were trying to make sure the hospitals didn't get overrun. We were trying to make sure, we didn't know how bad it was going to be. But every day, more data comes out that supports reopening businesses because it's not as bad as it was expected. And like I said, we are sensitive to the people that are experiencing health problems, people who have lost loved ones because of the coronavirus. But at the same time, we can take a safe and measured approach to opening up businesses and getting back to work. But I'm happy to be here today with my colleagues, and I appreciate everybody who's come out.
All right, at this time, we will be happy to take a few questions.
We just heard him say that the curve is flat, and we've had the weeks of the lockdown, of the shutdown. Isn't that kind of an indication that might be part of what's working?
Well, you want to speak on that?
Yeah, I just want to point out on that, and Stuart can weigh in as well, but, nobody really, from what I can see, has really tried to pin a start date on when this began. We started testing, and we know when those first, positive tests came back, but we don't actually know if it was here before we were testing. There is some anecdotal evidence that suggests that it was here much, much earlier, as early as the week after Christmas. And so the reason that's important is because, you have to know the start date to know where you're at in the curve. And, it just throws off your whole predictive model if you don't have accurate assumptions to begin with. And so that's one of the reasons why we're arguing that the curve is indeed flat, as well as if you look at the number of reported cases that are coming in, the death rate, which, obviously we want to continue to take whatever precautions make sense that we believe will actually have an impact on that. But we also have to weigh that against the number of deaths that could occur if we continue the present course of action. And so, we're up here because we care about people. We care about lives. We care about saving lives. And that's what we're trying to do. So any step that the government takes is going to have consequences, both good and bad. And we have to acknowledge that.
Well, just earlier you said that you haven't seen any evidence saying that the neighbors are work. You said that the curve is flat. You just said we're up here arguing that the curve is flat.
So I'm glad you asked that, because I really do believe that there's a bit of a correlation fallacy going on here. We took actions and things happened. What I'm calling on the governor today is to establish the connection between those things. You can't just assume that just because we shut things down and the curve is flat, that the curve is flat because of the shutdown. That's all I'm saying. So if indeed it started way back in December, January, it's quite possible that the immunity level of many South Carolinians is to a point that kept the curve flat rather than the shutdown. So let's establish what the actual causes are here.
And I'll speak to it too.
Okay.
Actually, if I could just ask this question, the World Health Organization just released a scientific brief Friday saying that there's not really proof just yet that the immunity actually works. Is that something you guys want to
You can answer.
Yeah.
You speak that.
Yeah, I think you got to look at some of these studies. There's some great studies coming out of communities across the United States right now, and some of those studies, testing that they're doing, are showing antibodies built up. Majorities of those communities having antibodies. So I think the virus has been with us a while. I mean, that's not to say people shouldn't take precautions. Anybody with any kind of immune deficiency, or the elderly, anybody who is open to getting those things, they should definitely take precautions. However, I think there's a lot more people that have already had it than we really know. And the problem is that a lot of the data that we've been basing our policy decisions on have been based off of the tested amount. We've all seen how difficult it's been to get testing. You know what I'm saying? So for people that have an active infection. So the fatality rate in many cases is being based off of the infected number that we've tested for. And that's important because it doesn't look at the overall how many people have actually had the virus in some capacity, which we don't know. But the good news to that is that it appears like in those communities where they have shown high immunity, that the fatality is very, very small. It's more comparable to the flu. So that's what we're looking at.
Let me answer the question, though, the previous question. So, sir, you asked about the are we really potentially was the cause of the flattening of the curve the shutdown, right? So you wanted an answer to that. So, okay, when we talk about evidence-based actions, one of the things that we've got to deal with scientifically is control groups, right? You got to have a control group somewhere. Fortunately, with the COVID-19 situation, we do have a control group, and that's the country of Sweden. Okay, Sweden has adopted some social distancing measures, but they have not done a lockdown like this. We also have South Korea. We've got Taiwan that have been more moderate on, not as liberal as Sweden, but they also have not done lockdowns. So you look at those countries, and they're about the same as the rest of the world as far as coronavirus rates right now. If you look at Sweden, it's actually among some of the better off nations in Europe. So again, going back to the idea of a control group, if you look at what would have happened if we had not done anything, the results are about the same as for the countries that are doing these lockdowns.
Well, when you point out South Korea, they've actually had quite some success with testing, and that's one of the reasons why a lot of folks point to the success with testing.
And I've called for more testing since the beginning of this.
Would that be something that would be
Sure.
more along the lines of what could give the business owners peace of mind?
I think we need more testing. I think we need more antibody testing. In the meantime, we need to take safety measures that will allow businesses to get back to work in the meantime.
About taking safety measures. Interview up here are public health officials, Dr. Linda Bell, the state's epidemiologist, and others federally have talked about the need for social distancing. This isn't social distancing right here. Talking about the need for more testing, things like that. So why not rely on the public health officials who are telling people these are the things we need to do in order to get back to business? Why push that? Why get more aggressive on public health?
So the medical professionals that I've been hearing from are saying that it's time for us to get back to work. Maybe the people who are high up in state agencies aren't, but constituents of mine, medical doctors that have called me, various ones. So there's been a number of them that have reached out to me and said, this is overblown and we need to get back to work. But as far as the question on what social distancing or safety measures that we're proposing, we do have some suggestions from some of our hair stylists and salons and so forth that they've made. They're talking about wearing masks and only allowing one person, per appointment. We're talking about, restaurant owners. I talked to one restaurant owner in my district who, he invested his life savings, over $100,000 in the restaurant. He purchased this restaurant and he was shut down. And, he says, well, why not just have every other table open or something like that? We need to get creative and, not take this, study committee weeks or months to solve all the problems for us.
Do you feel like Accelerate FC is a waste of time?
No, I don't think it's a waste of time. I just think it might take too much time.
Last week, the governor of Georgia began taking steps to reopen businesses like this, and President Trump, who has generally, over the last few weeks, been talking about liberating states and reopening things, even he said that he thought that was too soon and said he disagreed strongly with Governor Kemp's decision. What would you say to President Trump if he thinks that this is too fast?
President Trump doesn't talk to my constituents every day. And my constituents are saying, let's reopen, and so I represent them, not President Trump. Do you want to add to that?
I've got serious reservations with some of the recommendations that Dr. Fauci has made, and I'm glad we're cutting the funding from the World Health Organization. I honestly am. We need to listen to the people here. I got calls yesterday. One of my constituents is moving their business to Georgia already. They can't wait any longer. I got multiple calls from constituents that went to Georgia to get their hair cut, to get their nails done. So I think you got to listen to South Carolinians first and foremost. So we'll be happy to take one more question. Does anybody have any more questions? All right, well, I want to thank you for being here today. Please, we just urge everybody to call the governor and let's reopen South Carolina. Thank you.